Starting in 2025, Medicare Part D will introduce a $2,000 maximum out-of-pocket MOOP limit for prescription drug expenses, offering a significant shift in how drug costs are managed for beneficiaries. This cap is part of broader changes aimed at reducing the financial burden of high prescription prices. But what exactly does this limit mean for you, and how does it affect your healthcare costs? Here's everything you need to know. Understanding the significance of the $2,000 MOOP. The $2,000 maximum out-of-pocket limit signifies a sign you've relieved for those who spend heavily on medications. Once you've reached this cap, Medicare Part D will cover the rest of your prescription costs, providing a much-needed financial cushion. Before this change, beneficiaries often found themselves in the catastrophic coverage phase, a stage where they were still responsible for 5% of drug costs after reaching a certain spending threshold. This may not sound like much, but for expensive specialty drugs, 5% could still add up to thousands of dollars annually. The new $2,000 limit eliminates this additional financial weight. How does it work? The out-of-pocket limit tracks all the costs you pay throughout the year, including deductibles, copays, and coinsurance. Once your spending reaches the $2,000 threshold, your drug plan automatically covers the remaining costs for the rest of the year. This cap applies to all covered medications under your Part D plan, creating a safety net for those who require multiple or high-cost prescriptions. However, premiums do not count toward this limit. Who benefits the most? The $2,000 out-of-pocket limit is a game changer, especially for those with chronic conditions or costly medication needs. For instance, someone requiring expensive biologic drugs, which are complex medications made from living organisms, that might previously have cost tens of thousands annually, will benefit significantly. Seniors on fixed incomes and individuals with extensive medication lists stand to gain the most relief, as their annual healthcare budgets will become easier to predict and manage. What are the limitations? While the $2,000 limit is excellent news, there are some considerations to keep in mind. Does not include premiums. The $2,000 threshold only covers out-of-pocket prescription costs, meaning you'll still need to pay your plan's monthly premium. Plan structure. While the limit protection is important, your plan's initial cost structure, deductibles, copays, and tier pricing will still influence how quickly you reach the cap. Comparing plans during Medicare open enrollment remains essential to getting the best value for your needs. Financial relief for families. The $2,000 MOOP limit is not just a huge step forward for individuals, but also for families managing caregiving responsibilities. Adult children helping their parents with healthcare expenses will find this cap provides a sense of financial stability and helps them plan better for any ongoing support. This limit aligns with Medicare's goal of making Medicare more accessible and affordable for Medicare beneficiaries, especially given rising drug costs nationally. How will the $2,000 max out-of-pocket limit impact your budget or choice of Medicare Part D plan in 2025? Could this financial cap change your approach to managing chronic conditions or accessing expensive medications?